I would like to give you a brief background lang po ng ating guest speaker this afternoon. He is po a physician, a nurse, a pharmacy botanist, aesthetic dermatosurgery, and anti-aging practitioner, academician, consultant strategist, and entrepreneur. Let us all welcome no other than Dr. James Buado.
Thank you for that introduction, ma'am. Oo. So, yes, okay, good afternoon sa Pilipinas, of course, and we're actually going to have a topic on the inhaler. Okay, so this afternoon, I am tasked to discuss to you or to actually present to you our latest product in we provide, and that is the AltaImune Inhaler. So this is the nasal inhaler, or we also call it as a nasal stick. Okay, as you can see, okay, the lady is trying to occlude the nostril with this particular stick or the nasal stick. Okay, and then on the contralateral or the other nostril is being also pressed to not allow any air going in while you inhale or when you breathe in. Okay, so that you will have 100% pure inhalational products coming from the nasal stick. Okay, so the AltaImune nasal inhaler is also known as nasal stick that comes in a tube. So there is a cotton wick inside that is saturated with menthol, essential oil blends, and other ingredients that are incorporated. Okay, so this is being used as a nasal inhaler with the benefits provided by the essential oil. It's simple to take on the go and easy to use anywhere, anytime. This is how the packaging looks like when you will be purchasing later on. And of course, you will have to be giving this to some of your friends or relatives or some of your clients or patients. No po. So it's very presentable. It's really enticing. It says here, it soothes, it calms and cleanses. No, so it soothes the aches or the pains or the difficulties, and then calms your nerve, and then calms your respiratory tract, and it cleanses as well the whole respiratory tract. Ako, ang dami palang claims, no? Pero of course, yes, it's really true. So by just inhaling it, so then you will have all the benefits of this particular inhaler. Okay, so let me just have to dissect, what's inside a particular inhaler. So it has the case, the one that you cover, the inner shell, and then you also have a cap, and then of course the base is where you will have the wick actually placed, and then of course this is the whole set, no? Buong set na po ito. So, and then of course, let me just dissect to you the anatomy of the respiratory tract, because it's imperative that we know to where it is going to be placed or where it is going to actually traverse, no? Where will it travel, no? So, paano po ba ang sistema na ito? So, we have the respiratory tract or the respiratory system. So, initially, it will have to definitely be going into our nose through the nostril. Okay, so while the other nostril is occluded, it's actually being inserted, hindi po buo na ini-insert yung stick, no po? So yung tip lang po to the tip of the nose or your nostril. Okay, so first you have your nose in the anatomy. That's where it's going to enter. Then of course, going into your pharynx. Okay, the whole thing here from here is your pharynx. Okay, you have nasopharynx on top, and then the oropharynx in the middle, and this one is the larynx, wherein you also have that as the laryngopharynx. So even before it becomes the larynx, may laryngopharynx na tinatawag. Yun yung three divisions of your pharynx, okay? And then of course you have your larynx, which is your voice box, your trachea, okay, the windpipe, okay, going down. And then, of course, it's divided into your left and right bronchus until it will reach at the tapering end. Okay, we'll have, the bronchiole. Okay, so yung bronchiole nyo ay may naka-attach. Okay, say this is your bronchiole, which is the terminal end of your bronchi. Okay, so and then there is what we call unattached alveoli. Ito po yun para pong mga seaweed or yung rorosep, no, yung tinatawag. But of course, it is or it's similar to small na mga grape or grape-like structure na pedunculated or meron siyang parang tangkay, no? Yung tinatawag natin bronchiole. So, sorry. Okay, so here, iba ito po yung alveolus na tinatawag. Ang isa alveolus, ang pinaka congregation or sama-sama na alveolus, we call it alveoli. Alveoli, no? Pag maramihan. And then of course, inside certain alveolus, okay, so there will be a transfer. When you inhale the oxygen, okay, so huminga tayo or nag-inhale ng oxygen, it will be actually going into or diffusing into the capillary bed. So yung mga maliliit na mga blood vessels. Okay? So that it can actually be going into the arteries, okay? And then of course, later on into the veins also. Okay? And then of course, it will have the exchange of oxygen and then of course, exclusion or removal of your carbon dioxide. AltaImune nasal inhaler contains of aromatic compounds that go through your trachea, yung sa pinakagitna, okay? And then going into the bronchioles when you breathe in your essential oils. Okay, so when they get into your alveoli, the oil enters also into the bloodstream. So similar with the oxygen, these fumes or these active ingredients goes inside your bloodstream. And then transfer of these will allow you to feel the effects of the inhaler, and this is even faster than when you have to digest or apply a certain product to the skin. So it says here the big difference is even when you have a nasal inhaler, it's fastest, no, than when you have to drop, okay, sa inyong lalamunan, yung AltaImune drops. Okay? Sana yun na lang nauna na produkto. Meron naman palang mas mainam na ano. Of course, yes, it could be that. But of course, nung time na ginawa po ang ating nasal inhaler, it was just actually after that they went through some tawag nito, research and of course trials. No po? And then of course, but of course, later on you will hear that of course it has a beneficial effect when combined with the drops. Okay? So faster when it is actually inhaled. It is made with different types of 100% pure, natural and certified therapeutic essential oils that are botanically and biochemically defined. Okay, so and possessing antiviral and anti-inflammatory constituents. Okay, so it has antiviral and anti-inflammatory. So what's the difference? It's basically just the same. Kaya lang mas mabilis siyang na-absorb. No? Okay, as compared with your AltaImune drops. Okay. It contains 3 synergistic activities of essential oils, potentially helping in eliminating and destroying the viruses, okay, that enters through the nose, which is your portal of entry. So basically, halos pareho lang na mechanism of action as previously discussed when we had, okay, AltaImune drops, okay? But here, okay, the difference is there is a lessening of the active ingredients as compared to the nasal, compared to the AltaImune drops. So it has only peppermint, ravinsara, and then oregano. No, as compared to yung sa ating drops, we have several others that were incorporated with all synergistic effect also. The top benefits of nasal inhaler, okay, we'll have to discuss this kasi at least para makumpara kung alin ba mas mapisa or alin ba talaga ang mas dapat, okay? But then of course, okay, number 1 would be some allergic relief, no? Or allergy relief. Okay, so when you have, say for example, nasal congestion or difficulty of breathing due to the obstruction of whatever, say, turbinates sa ilong, or minsan talaga puro sipon or clog talaga, because of the histamines, no? Kasi po pag may allergy, may histamines. Kaya po umiinom tayo ng mga antihistaminics to relieve of the congestion brought about by the accumulations of fluids when you have congestion. Or even when, alam po yung tinatawag na cardinal signs of infection or inflammation. Okay, so meron pong kasi pag may allergy, may inflammation. So then you will have redness, okay, namumula. Tapos may change in temperature or calor. Meron ding dolor na pain. Minsan, of course, due to the congestion when everything is enlarged, even the blood vessels there. And of course, you will have relief of anxiety and stress when you use this benefit with nasal inhaler. So relieves you of the anxiety. When you have some pains and aches and all that, you can also be anxious. And then of course, yung stress related to work and all that, when you will have to be inhaling, okay, then you can be relieved of this stress. Okay, these could be a distressor. Okay, so and then of course it increased the energy level and focus. Okay, so that's actually when you're actually kind of sleepy or parang you want to actually have some increased energy, then this can actually be boosting your energy level and focus. And then of course also it actually boosts your mood. Okay, so and then of course it alleviates the nasal congestion as mentioned a while ago. For coughing, it's actually for lessening of the cough or the spells for that, and then enhances the smell. It reduces the headache and migraine. Okay, especially for those who are constantly having some tawag nito yung parang stimulus, okay, to actually having migraine. So it could even halt the migraine even before it could be starting. So it improves also your sleep. Can actually manage your pain. Okay, it lessens your pain or your burden of pain. Okay, and then of course it has antimicrobial property, meaning it could be antibacterial or even antiviral. No, and then of course it relieves you of nausea. Okay, so also it improves digestion. Meaning after eating, you can actually have this or even to actually increase your appetite could actually be benefiting from this nasal inhaler. All right. Okay, oregano, and then of course this is we call as parang originally as hyssop, and then it is strong, it is resolving and powerful. So you make use of the leaves that were actually distilled, okay, and then they contain all the active ingredients to, okay, 43.97% carbacrol, and then cyanine, okay, 17.87, and thymol. So all of this, okay, oregano is known for its antimicrobial property. So not just bacterial and viral, but it also can be antifungal and also antiparasitic or the parasites, okay? So, and then it simulates your immune system. So once you have oregano, okay, then you can have all the microbes, okay, eradicated, okay, especially in the nasal or in the respiratory tract. Okay, so it can be viruses as mentioned, okay, and then bacteria. And then, of course, when you have a strep throat, okay, the normal causative agent for the first, what's this, yung streptococcus throat, or is the strepto? Well, of course, the name implies it's the strep, no? Okay, and then when you have tonsillitis, then you can have this, benefiting from this. Okay, and then, of course, staphylococcus infection. Okay, and then, of course, wound healing, and then pain reliever, and then it can be used for as an adjunctive treatment for some of your tuberculosis or even for pneumonia, canker, sores, warts, and all. Then the second one is the peppermint, well, also known as balsamea or menta balsamea, which is the wild kind or type of this peppermint. And then a hybrid mint, which is a cross between a water mint and a spearmint. Okay, that is indigenous to Europe and the Middle East. So it has several components. Then, of course, it has mainly menthol. So peppermint is mentholated, okay, and then it has also menthol, isomenthol, cineol, then acetate, menthol acetate, and then methylfuran, limonene, mycirine, caryophyllene, polygon, and then of course, and a whole lot more. Okay, so let me just have to have this on top probably too. I sorry. Okay, so maybe let me just have this on top. All right. Okay. So and then of course there's another one that I have missed out on, which is the carbone. Okay, so these are the active ingredients of peppermint that are lumped together with oregano, and of course, the peppermint is invigorating. So it invigorates your body. It has a cooling and adaptive property. Okay, the lids are also being used, and the distillate form is the process of collection of all the active ingredients or the constituents like menthol, and then alpha and beta kinase and acetate. So the good thing about peppermint, it has the expectorant property or the ability to expel or withdraw or remove of all your phlegm. Okay, it has anti-inflammatory property, analgesic, anti-spasm, and then vasoconstrictor, and it stimulates your cells to regenerate. Okay, so the immunomodulating effect of your tumor necrosis factor alpha, no, immune, which is your immune system, and modulatory effect to actually boost or increase your immune system effect, and having your tumor necrosis factor, and its main role or its roles are actually for the regulation of the immunity. Then of course, it also resolves of the inflammation, and then the program cell death. Of course, all our cells, lahat po ng ating mga cell ay may mga uh, equivalent na lifespan. No? Namamatay din yan. Of course, it has to be replaced and it has to regenerate. Okay? So, and then of course, yung angiogenesis, okay, the ability of our blood vessels to regenerate, okay? And then of course, our bagong mga blood vessel formation, if and when, say, na-occlude or nabarahan yung isa, okay, then of course, it will have to reform or formulate a new blood vessel. Then of course, coagulation of your blood, okay, and then of course, growth promotion and inhibition and energy homeostasis, okay, which is the balance of our system. Now, it's being used for fever and then for allergies and yung mga pamamantal, yung hives, no, headaches, migraine, asthma, sinusitis, loss of sense of smell, alertness and energy, and muscle tension and pain. So now the third one is the Ravensara, which is actually relaxing, reviving, and clearing. So same thing, the leaves are being used, and then of course the content is actually the alpha-pinene and the cineol. Okay, so it's being used for antimicrobes, okay, viral, bacterial. It's actually an immunostimulant, and also it expectorates, okay, the phlegm, okay, and then of course analgesic in its effect, okay, so pain reliever, muscle relaxant, antioxidant, okay, so for free radical scavenging, and then of course anti-inflammation and anti-tumor. So basically it covers, okay, the thing that is being covered by, okay, those that we have in the AltaImune drops, no? Of course, the good thing about the AltaImune drops is that, of course, there are other um, act, act, active ingredients, or say materials that actually are being used to combat or to actually eradicate and eliminate the microbes. Kung hindi umubra sa isa, then of course there's another one who has a synergistic effect or may have a better effect in trying to resolve the problem. Okay, here, okay, everything is covered, but then of course, tatlo lang talaga yung active ingredients that are being used for respiratory tract. No? So ito po ay mas mainam or mas mabisa sa respiratory tract itong tatlong ito. Then, of course, the Rebensara is being used for chills, for flu, for whooping cough, bronchitis, germ, muscle, joint pain, infection, irritation in the skin, body, and inflammation. So basically, anti-inflam, antioxidant, antimicrobial, anti-tumor, and all that. So yun yung mga halos kapareho rin ng mga effects ng nauna nating ginagamit na AltaImune drops. Okay? So when we say Ravensara, it has an anti-inflammatory effect, wherein when we call inflammation, it is the single condition that give rise to a lot of symptoms and complications of respiratory problems. So it needs to be suppressed or regulated, otherwise then you will have difficulty of breathing. Huh? Okay, especially when you have been afflicted by, say, a SARS-CoV-2 virus. Okay, the recommended daily use is just two to three deep inhalations under the following conditions. Okay, so before leaving your house, you have to have 2 to 3 deep inhalations. So upon returning and before entering your homes, okay, you can have 2 to 3 deep inhalations before exposure to a crowd, after exposure to a crowd, and then especially for those who are actually going for some campaigns, no? Ngayon, talagang a lot of us are getting involved, no, para sa ating halalan. So medyo pag kailangan po natin at hindi talaga ma-prevent na hindi kayo sumama, no, kailangan po meron kayo nito. So meron protection. And then of course, you can spread it to those people who needs it also, because we're all vulnerable, and then we can actually be acquiring any other viruses, not just the SARS-CoV-2, but other viruses that proliferates and then actually harbors a lot of detrimental effects sa ating katawan. So when you will have to also be needing it when you have some congestion or irritation. So then that would soothe you, and then that would calm you, and then of course relieve you of all your problems or concerns in the respiratory tract. You can store it at 28 degrees Celsius room temperature and do not expose to sunlight to avoid the oxidation. Okay, so iba po, parang when we always would see sun, okay, or sunlight, okay, then okay, there is the vulnerability of our cells to oxidize. And even with the weak or these ingredients, it could actually be oxidizing the active ingredients. So it's important that when we have both the inhaler and also the AltaImune drop, okay, so hindi po siya dapat naka-expose sa sun. Or minsan yung iba dahil sa pagmamadali, okay, they would place it in the dashboard or kung saan na merong habang nagdadrive, okay, then okay, exposed to sunlight. Okay, and then of course you have to use this under medical supervision for those who have some allergic reactions, say for example, but then it's not actually a total concern because it has antihistaminic property. Now, special precautions and warnings only for adults. So it's used by adults only because there has not been a total study or a trial for kids, no? So or children. But in the event, say for example, that there is an emergent or urgent case that needs to have this, okay, to relieve or to decongest while actually waiting for, say, an ambulance or say going into the hospital, okay? So medyo pwede pong, of course, as an emergent measure, then we can actually make use of this, but not actually to have it for a long period of time or as a maintenance, okay? So it's not really for children and pregnant and lactating mothers because of not really, they're not really included in the study. Okay, so in this particular study po, as I am actually mentioning, so an individual under drug treatment should secure approval from physicians prior to consumption. So any of the medications that would be contraindicated, then you have to ask for the approval of your doctor. So allergy should be avoided to sorry. Okay, if you have allergies, it should be avoided to any of the active ingredients or contents that you are actually allergic to. But if not, okay, then it's actually okay. So you may have some serious or very serious allergic reaction to some of the supplements, but it's actually rare. So we're not saying that, okay, it's absolutely not going to cause you some allergic reactions, especially for those who have allergies already to these three active ingredients. So immediate medical attention, if you have, say, seen some rashes or itchiness, you have swelling on the face, also in the tongue and the throat, or may have some severe dizziness or trouble breathing. Okay, despite you actually placing it, it's not actually relieved, no? Hindi ka nare-relieve, then of course you might just have to be going to your hospital or to the emergency room. So the best position to have this is in the reclined or sitting upright position, meaning this kind of position that we're having, that we're all seated, that's the best one. Okay. But, okay, not like this. Okay. So it's not even, okay, inserted halfway through or even the whole stick. Oh, no, hindi pwedeng ganyan. Of course, number one, though this has antimicrobial property, it can be actually contaminating the whole thing. No? So pag na-contaminate, na-overwhelm, or hindi man sabihin na natin that of course there are some other microorganisms that might be resistant to the active ingredients, no? And then they can contaminate. And even the dirt can actually be contaminating it. Now, when you have not actually cleansed your nostril and you've inserted this, then definitely there will be some contaminants to it. Okay, so you don't do this, please. So pregnancy, breastfeeding, not enough information rather, and then to make it actually safe, you know? And then of course, there has been no reports on the side effects on the dose adjustments or special tests when taking medications. So actually, we're just having some precautionary measures, but then actually there are not much of reports yet on its side effects. Okay, it may interact with medications like the herbal products that might decrease the blood clotting and may increase the risk of bleeding, such as when you have, okay, those that are taking warfarin, heparin, those that are actually trying to thin out their blood, no? Okay, those are hypertensive, and then of course, those who are taking some antiplatelet drugs like clopidogrel, NSAIDs, and then of course, ibuprofen and even aspirin, and herbs like ginkgo biloba. So these may have interactions and might have to be assessed by your physician if and when you need to, or you can actually be sustaining, which is okay, few inhalations or few times of doing this. I would just like to allow to tell everyone that when you will have to stick your nasal inhaler, okay, you will have to breathe in slowly, allowing a deep breathing, okay? And then after you have breathed in, okay, so when you inhale, 1, 2, 3, allow it to just be parang may pause ka lang so that you can have the fumes or the vapors going inside your lungs, and then of course allowing, since it's congested at times, no, congested, maraming mga phlegm and all that, allowing for it to sometime be lysing or parang iliquify niya yung iyong phlegm, no? And then of course at that time apparent also when you have inhaled and expanded your lungs, okay, then that will be an opportune time for these vapors to just go into each of the alveoli. So that's how you will have to do that, at least 2 to 3 deep breaths. And then when you have to exhale, you have to exhale slowly also. So slowly, and then of course releasing the carbon dioxide altogether. So when this is constantly being done, it will definitely be soothing. It will be definitely be clearing you of whatever residuals or remnants that you have there, microbials in the lungs. And then of course, it will be coming every single thing, your nerves, okay, your respiratory tract, and then you won't have problems. And even your muscles, it will be actually calmed by this particular nasal inhaler. You know, sometimes when you are constantly coughing out, okay, especially a sticky one at that, yung medyo mahirap na palabasin na phlegm, okay, tapos and then of course obstructed, no? Minsan sa sobrang kakaubo, of course your muscles also tend to be also stressed, no? Medyo ano siya, nagiging rigid or spastic. So that alone can also cause your muscles to cause pain, no? And even your bronchi muscles, okay, sa loob ng inyong mga uh, lagusan ng paghinga, of course, there are also bronchi muscles there that will actually can have some manifestations of pain when you are coughing out. Okay. So, I guess that's just about it. Okay, for your questions, okay, ano po ba ang mga agam-agam or questions niyo regarding po sa paggamit ng nasal inhaler? Okay, so we can actually ask or rather we can answer some of your questions. You can raise them at the chat box or you may actually just go and you know, raise your hand, and then of course then Miss K will have to ask you to say your questions. All right.
Okay, Doc. So this is not about the AltaImune Inhaler, Doc. So her question po is about AltaImune drops. So meron daw pong cancer na stage 4 sa liver, right ma'am? And kung pwede daw po bang mag-take ng AltaImune natin and paano po yung correct way ng pag-take nito?
Okay. So actually, stage 4 liver, parang, of course, we have an empiric drug na ginagamit dyan. So, as basically, yun sinabi ko rin yan doon sa ibang mga klase ng cancer. So, usually, pag ginagamot yan ng mga stage 4, lahat, kasi parang end stage na yan, lahat ng mga aggressive form of medication is already being given. No? Yung talagang medication po. So, chemo, radiation, so or combination of that, and plus some other drugs. So we just allow them to have that yung aggressive mode no para medyo ma-eradicate kasi talagang, but of course kung tinatanong nyo if we have that study no na ginagamot natin for stage 4 or yung mga end stage cancer, wala tayo talagang ganon. And it's not actually the one that we actually use. Hindi siya talaga drug or gamot for that empiric for cancer. So, but then it could be supplementing and boosting our immune system. So, yun lang po. Pang immune system tayo to actually increase the ability of the patient to form good parang defense against potential na microbes or some yes, okay, ang potential kasi ang problem kasi is that when you have end stage mga ganyan na mga cancer, they also have a weakened immune system. So we're just actually just going to have basic ano lang natin sa immune system to increase the immune system as a stimulant, okay? Then we can we can still have the same formula, of course, which is actually 3 times a day, okay? Morning, afternoon, and nighttime.
Next question about our AltaImune Inhaler po. Yes, ma'am.
Yung kasi ang nangyayari kasi sa akin, pag every time na sa yung carbon, diba?
Yung carbon.
So, ngayon, nagpapan na naman.
So parang allergy po dun sa car. Doc, we have here a question po, our second question. Parang si ma'am daw po, every time na nang-stay sa car, parang nagkakaroon siya ng pantal-pantal po due to carbon. So, is it good po ba? Ano po bang product natin ng good for her po?
Actually, yes, of course, which one is best for her, no?
Yes.
Kasi,
yes,
of course, both of these are actually having antihistaminic properties. Well, you're right about having some allergic reactions. At least alam mo kung saan yung allergen mo. So it's really coming from the dust, or even coming from the smoke from the cars, no? Minsan yung sa fumes that are actually going inside the car, so it could actually be causing you some hives or pamamantal, no, or some allergic reaction. This could be actually yung autoimmune drops natin could help you with the antihistaminic properties, no? It has anti-allergic property. So po pwede siya. So kung normally it's used as drop, no? Pero of course, when say you have some headaches, congestion secondary to the allergic reaction, then you can use this also, the inhaler. So pagka yung iba, I am really well, of course I am relieved with this. I normally would be having allergic rhinitis, no? So medyo sa umaga, ngongo ako. So pag halimbawa nagawa na or in-inhale ko, of course this would actually make me feel na relieved by the allergy. So without having to go for another pill or ang tawag paggamot na para sa allergy. But if and when sobrang tindi, then you can actually have your normal antihistamines, no? Yung mga pang anti-allergy ninyo. No. Ako, I'm really already with this too. So normally I cannot speak in the morning. So medyo, of course, because of the congestion. But then, of course, in the morning when I would use this, I really would have relief of my symptoms.
Thank you, Doc. Doc, follow-up lang daw po kasi yung husband daw po ni Ma'am heavy smoker daw po. So yun daw po yung madalas na naaamoy ni Ma'am.
Actually, yes. If yung
Doc, may suggestion. May nag-suggest, palitan daw po yung asawa niyo.
Nakakatawa naman ng. Well, it may be a suggestion, but it's not a good suggestion.
Yes, Doc. Maybe kotse na lang daw po palitan.
Hindi, actually, siguro nga yung mga smokes and fumes from the tobacco and then, of course, the cigarette. Talagang really, for those who are allergic to it, you really have to stay away. Kasi pag talagang makulit or matigas ang ulo na nagsusmoke, even not respecting you of your health, no? Kasi not only that, hindi lang allergy. If like constantly you're allergic to it already, then you can be a second-hand smoker. Meaning you can actually, mas matindi ang epekto sa mga nakaka-inhale ng mga fumes ng smoke ng cigarette. Kasi sila at least filtered sila, yung mga nakakasinghot or nakakaamoy niyan, hindi. Of course, it goes straight to the lungs and they're the ones who are vulnerable to having bronchogenic cancer or lung cancer. No, yun yung mas nakakatakot. Oo. So please have them to stay out of the house, and then of course if they would really be sa mga mga may tawag to mapuno or mga halaman na area, so that the carbon monoxide that they're actually yung binubugan nila, of course, will be absorbed by the plants, no? Oo. So wag pong i-allow sa bahay, especially kung may mga bata, of course, mas vulnerable sila. And then of course, yun na nga they have to be informed that it's really not good to smoke at all. Oo.
Yes. Doc, same lang po ba ito sa mga nagve-vape?
Okay, so there has been studies also that the vape is not it's not safe, no? Parang sabi nila it's parang choosing lesser evil but still is evil. No po. So sabi nga nila, eto hindi to nakaka-cause ng cancer. No, there are studies that that would say it has caused cancer as well. So there are vulnerable cancer cells there that that are just waiting to be stimulated. Up until the time that they're stimulated, then they develop into cancer. So please po, wala naman po talaga siyang benepisyo. So then of course, even the vape, there's no guarantee that it will not cause cancer. As it is increasing now that marami po ang nagkakaroon ng cancer even with vape.
Yes, thank you for that, Doc. Thank you po. Next question, this is about our AltaImune Inhaler, Doc. So, what is the youngest age po na pwedeng gumamit ng ating inhaler?
Actually, for the safest answer to that, I would stick and abide to, okay, for adults only, 18. Okay, but then of course, sabi ko nga kanina, in the emergent, urgent cases that, it needs to be transferred or to be relieved by it immediately, pwedeng, parang you can resort to it, but not to have it for prolonged stage amongst adolescents and kids or toddlers. So, say sobrang congested, needs to be going into a hospital or while still being transported, and then kung walang ibang measures to have it, though kasi di ba ginagamit natin for some allergic reactions or so, yung mga congestion sa mga bata would just be, okay, a hot water and, okay, a salt. Okay, yun actually yung pinaka-emergency. But even when, say, you don't have those things, okay, then you can have that for immediate or, say, an emergency case before you can transport your child or your toddler to the hospital. But then, of course, it's not being advocated sa kasi walang study. Yun lang po. Hindi nakapag-study na include yung mga buntis, lactating, at saka bata or less than 18 years of age. Just to be safe.
Thank you, Doc. Thank you for that. So, we have po our question from Miss Ronaline. So, madalas daw pong nag-nosebleed yung kanyang father. So, if it's good daw po ba na paggamit ang ating AltaImune Inhaler or AltaImune po?
Okay, I don't know wala tayong alam doon sa root cause of yung bleeding. So, of course, that has to be attended to by the ENT specialist niya. Oo. So, or if not, okay, then it has to be seen kung ano yung nagko-cause ng pagdurugo. It could be an infectious, meaning of course, or say, it could be dengue hemorrhagic fever. It could be also the lowering of the platelet count secondary to some bleeding problems or some bleeding tendencies. Or it could be also due to change in temperature, sudden at that. No, medyo bigla siyang say sobrang init, and then of course biglang magpuputukan yung mga small blood vessels that causes the epistaxis. So marami pa yan. It has to really be seen by the doctor, or even when baka may cancer sa upper part ng skull, ng brain. Oo, so it could be that. So it has to be, or it could be due to a trauma. So kung constant siya, it has to be really be examined by the ENT specialist para malaman kung bakit siya nagdurugo.
Yeah, so very important po to know, no, Doc, kung ano po talaga yung pinag-tumulan, kung bakit, yung pinaka-reason po talaga. So,
Tama.
yes, thank you very much, Doc James. So, we have...
Ano daw? Oo, hindi ko naririnig. Medyo
it's good daw po to use our AltaImune Inhaler even if you don't have the congestion po.
If you don't have the congestion, or tapos you want to use the inhaler.
Yes, Doc.
Oo. Alam mo, hindi naman sa ang tawag doon ay habit forming. Alam mo kasi, gustong-gusto mo kasi yung amoy. It relieves you of your tension, anxiety, your panic mode, and you want to be distressed. You can actually be just doing it. Okay, pwede naman po. Wala naman pong addicting effect dito. So, okay rin lang po. Even if you don't have congestion, it could actually address all the other problems or concern, and you can actually benefit from that. Okay lang. But when I'm stressed, yes, I actually would inhale, or parang when I'm actually panicking, okay, I would inhale. So medyo tension, may tension headaches, mga ganyan, or even migraine, so pwede po. Opo. So wag lang po yung sabi ko na naka-insert siya the whole time.
Yes.
Hindi siya maganda
Ina-avoid na po natin yung Doc. So there's a do's and don'ts sa paggamit ng ating AltaImune Inhaler. So thank you very much po, Dr. James. So any other questions po? Meron pa po ba tayong katanungan about ating AltaImune Inhaler? Anyone?
Pwede ba siya ilagay sa mask?
ang AltaImune Inhaler po, ilagay sa mask, Dok. Meron po tayo
Ilagay sa
mask. Before we wear our mask, Dok. Yes. kasi
before we wear our mask, yung alin po, yung inhaler, parang wala
Opo.
naman po siyang liquid.
Opo. So,
Oo. Meron yung before,
Yung
yung
oil
nag-ano
natin,
dun sa oil, o naglalagay
pwede yung
sila.
oils po natin.
Oo,
Yes,
oo.
oils po natin, ma'am. Breathe easy po yung pinaka-recommendation na ilagay
Actually,
natin.
yes. So, mas ma-okay pa yan, yung breathe
Correct,
easy.
no, no?
Oo, tama ka.
So, yung
Oo.
oils po natin. Thank you, Doc.
Alright.